Hello all my viewers, welcome back to my YouTube channel. My name is Terry and my channel name is Terry the RN and Kids. We are privileged today to have a guest, so I will give her time to introduce herself and then she'll take us through the topic of the day. Welcome.
Thank you, Terry. My name is Dr. Faiza Nasir. I'm an obstetrician gynecologist and I'm also a gyne oncologist. I'm based at Coast General Teaching and Referral Hospital, but I also run a private practice at Pandia Memorial Hospital, Doctors Plaza. And it's my pleasure to be here today to discuss today's topic on menstrual disorders. So we know that menstrual disorders affect women in the whole spectrum, from puberty to almost postmenopausal women who have now stopped getting their menstrual period. And it might sound to be a very easy and not worrisome condition, but it really affects the quality of life of our women. And sometimes as women, we try to brush it out, but it's something that we need to take charge. And whenever we experience these menstrual disorders, which I'm going to highlight, we need to seek medical advice early enough. So the menstrual disorders that affect women, I will categorize them into different age groups, but the commonest one is people who normally women or girls attain puberty by 12 years of age, 12 to 14 years, but now we are seeing a trend where menarche or starting of menstruation starting much earlier, and this is mostly because of our lifestyle changes in our young girls. So when we have pubertal girls delaying in getting their menses more than 16 years, as parents we should get worried. So we call that amenorrhea, that you have not started getting your periods. And the amenorrhea can be primary, and that is for those who have never received their periods, or secondary. So we will have girls sometimes who have received their menses, but then they get a period where they don't get their periods. As parents, when we have such a situation in our girls, we should get concerned. And the first thing we should be worried is she pregnant? Yeah. But most of the time, it's a normal physiological state where you get your periods and then you get a period where you don't get your periods for around 6 to 8 months. Another menstrual disorder that we can also discuss, and this mostly affect women between 25 to 35, we call them abnormal uterine bleeding. So when you have abnormal uterine bleeding, it means you might bleed heavily. Normally, the normal period where you should bleed is to 5 to 7 days, but these women bleed longer. So apart from them bleeding longer, they also bleed heavier. Yeah, and then they also might have pain. So we call that dysmenorrhea. And dysmenorrhea can also affect the young girls. So it can either be primary. These are people who, from the start of their periods, they get pain, or they can have secondary. That is now, it comes after they have received their period. So we call that secondary dysmenorrhea. So those abnormal uterine bleeding, when they happen in women, they need to seek medical advice, because the commonest problem, it could be you have, because if you let yourself bleed for long, you will have symptoms of anemia. You will become weak, you'll become dizzy, you'll frequently be having headaches, and could be a sign of of a problem like fibroids. It could be adenomyosis, it could be a polyp. So it could even be cancer. We nowadays see cancer of the cervix, of the endometrium at an early stage. So whenever you have periods that have prolonged, they are heavy, there's pain, then you need to seek medical attention. Then we have what we nowadays see a lot, is called premenstrual syndrome, PMS. And a lot of women will say, I have PMS, because they are bloated, they are irritable, they have headaches, they have symptoms that they cannot really explain. And this sometimes or they happen during the time they have periods. So they are very irritable, and this is because of retention of fluid. So whenever you have this, we'll discuss how can you address premenstrual syndrome. Yeah. So another menstrual conditions that they get is, I said, dysmenorrhea, premenstrual syndrome, abnormal uterine bleeding. And then we have that age bracket between 40 to 45 years, where now we're almost attaining menopause. Yeah. So there you can also have some menstrual disorders. Either you have less bleeding now, you're spotting, your periods start by spotting for a few days before now they take effect, or you have longer period, yeah. And then comes the menopause. Once you have attained menopause, and we say for you to say you're in menopause is you lack your periods for more than a year. And then when you start getting periods, or when you bleed after you have attained menopause, then there is a problem and you need to seek medical attention. It could be a polyp, it could be cancer, it could be just that your endometrium, which should have shrunk now during menopause, is now becoming thicker. So these are the spectrum of conditions that can, menstrual disorders that can affect in the whole age bracket of women in their reproductive age. So coming to patients who have, how do you manage them? So management of all these conditions, we can divide them into three. One is lifestyle change. Yeah, we are now in a holiday season, and I mean this is a time to binge and eat and enjoy and relax. But we should also put in some time to exercise. Relaxation is good, but exercise, walk a lot, drink healthy food, avoid junk food. This actually helps some of the symptoms that people experience, menstrual disorders. There's some, and then there's a medical management where you offer medicine that I'm also going to mention. And then there's a surgical aspect of this menstrual disorder. So if we come to the younger age group, when they have amenorrhea, when they have not received their periods, when they are now 16 years old, then you need to seek medical attention. For you to get your periods, there are a number of interplay that take place. There is the brain, where we have an organ called hypothalamus, which release a hormone GnRH, and then it acts on the pituitary to release another two hormones, which are very known as FSH, LH. And then they are the ones that act on the ovary to now release estrogen. Yeah. So all this, if there is a problem anywhere, it can actually be the reason why you've not received your periods. Sometimes it could be so we have this organ called the uterus, yeah, with the ovaries and the fallopian tube. So sometimes there are patients who they have a structural problem that makes them not have their menses. Yeah, maybe during their development, when they were growing up, there was a septum that now affects the outflow of them getting their periods. So whenever you should, as a parent, as a mother, you should get concerned when when your girl has not received her periods when she's more than 16 years. And then for those who receive their periods and then they have a period where they are not getting periods, you should also seek medical attention. The first thing in our young girls, they can, and God forbid, is they can be pregnant. So a pregnancy test is the first thing as a mother you can do. But having said that, it's normal for you to miss your periods, and it's to do with hormonal imbalance. So that age where things are starting up, they get issues with hormones. So the medication that you can be given, one could be a lifestyle. Maybe the girl has gained weight, so they can be asked to exercise, have less of junk food. But if it doesn't happen, then we can give them some medication. We can give them, start with non-hormonal medication, and they're available. And if it doesn't work, then we can give them combined oral contraceptives. So for young girls, we limit ourselves to that level. But for older women, then there's also maybe surgery in it. For dysmenorrhea, so don't sit back and say, I have pain, this is normal. So it has to do with some inflammation that happens during the time you get your periods. So there are medications that can be given to reduce that inflammation so that you have less pain during your periods. But also, it could also be signifying that there is some more to just a normal phase that we go through. It could be because you have endometriosis. We have a lot of endometriosis in young girls nowadays. It could be an infection that is ongoing. Apart from you getting your periods, you're young, you're still trying to adjust. Yeah, so infections can come in because of hygiene. So also as parents, we should also take it upon ourselves to teach our girls how to take care of themselves during the time when they're in their menses. So that's about amenorrhea. So it comes to now abnormal uterine bleeding. And I think that before I move to that age bracket of 25 to 35 years old is what we now call PCOS, polycystic ovarian syndrome. We see a lot of this and our young girls are reading about it, they're becoming more aware. So polycystic ovarian syndrome is a syndrome. So when you have a syndrome, it means you have more than one thing. So you have some factors. So they have periods that you keep missing your periods, and also you can have features in the scan or some laboratory tests that are done to actually confirm that you have polycystic ovarian syndrome. Apart from that, they have features of more male hormones in this young girl. So they have abnormal hair distribution. They have hair like a mustache. They have pimples in their face, acne. All this is because of androgens here. So PCOS is also becoming very common in these young girls, and it has to do with lifestyle modification. You need to exercise, avoid junky food, and then the doctor will put these girls into medication. So that's for the young girls. But for that age group, 25 to 35, 40, these are patients when they have abnormal bleeding, then they need to seek medical attention because we could be dealing with fibroids, we could be dealing with adenomyosis, we could be dealing with polyp. So apart from lifestyle changes, we need to be put on medical management. Surgery becomes an option if it is persistent, if it's affecting your quality of life, if they're becoming bigger and they're becoming more symptomatic, if it's a fibroid, if it's adenomyosis, if it's a polyp, so then it becomes necessary. But for those women now with dysmenorrhea, like I said, dysmenorrhea is inflammation. So we have medications. People say because you're retaining fluid, and maybe because some of the things that have been postulated to be the cause is salt intake. So maybe you need to reduce your salt intake, exercise, relaxation, the yoga, for those who can do yoga. All this help to reduce some of this inflammation. And then their medical management. We give them some mefenamic acid for them. So sometimes dysmenorrhea comes with heavy bleeding. So we put you on medication that will reduce your bleeding episode. So that's about dysmenorrhea. For premenstrual syndromes, same thing. Reduce lifestyle change, relaxation, analgesia. But for women who have attained menopause and they're bleeding, then they need to go for evaluation, and the evaluation will start with examination. They'll probably have a speculum done to confirm that the cervix is okay. There'll probably be screening done, whether with acetic acid or pap smears should be done, and then an imaging will be requested, like a pelvic ultrasound, and from there additional investigations may be required. So all in all, when you have any menstrual disorder, don't sit back. You need to seek medical advice early enough, because some of these things can be reverted back to normalcy. But if you delay, they can actually delay you from probably conceiving or maybe progression of disease, and also your quality of life might be affected. Thank you.
Okay, thank you so much, Dr. Faiza, for that. That was so informative. And I always come across a few questions like which are the best drugs to be used when you have dysmenorrhea, especially for the young girls, because sometimes some people say some have gotten kidney issues because of overuse of painkillers. Like, can you take us through the best medications that teenagers or any person having dysmenorrhea, the recommended ones?
Okay, thank you, Terry, for that. So, like I said, dysmenorrhea. So, because of that, what Terry has said, people avoid painkillers because they're worried that their kidneys might be affected. So one is your lifestyle change. Drink a lot of fluids. Start by exercising. All this will reduce the inflammatory response. Hot water bag also helps for those who have mild dysmenorrhea. But then when you talk about inflammation, we can start with, you need to start from low and probably escalate up. So you can start with the paracetamol, oral medications, but the one that is recommended is mefenamic acid, and there are different brands of mefenamic acid in the market. So either they are singly mefenamic acid, but some also have some drugs to reduce the bleeding. So they have mefenamic plus tranexamic in it or xylate in it. So you can have a mefenamic acid on its own or plus additional drug in it. So we prefer mefenamic acid for these young patients, but also antispasmodic. There are many brands of antispasmodic in the market. We can also have mefenamic plus antispasmodic in it. So those are the medications that you can take. But for those who have issues with peptic ulcer, then they should avoid the diclofenac injections. Yeah, but mefenamic acid, paracetamol are safe enough. But hydration is also one of the things we should always encourage our young girls to do.
Yeah. Okay, thank you so much for that information. If you have any questions, you can ask. You can put your questions on the chat box, and we will find time to respond. So I'll end up by saying thank you so much, Dr. Faiza, for giving us this opportunity to have a discussion with you. We will invite you another time because we have so much that we need to get from you.
Thank you very much, Terry. Thank you.
Bye-bye. Thank you.
How did it go?
Ikoje?
Iko nzuri.